that wasn't here.
I think it's
With health services, number 7.
Does that sound like her words?
He's right here.
And I do want to announce that lunch will be brought in at 1 o'clock today.
Oh, excuse me.
What we having?
I have no idea.
Pizza.
Hard fry.
I was out there when they ordered it.
So glad that you got all
I helped them decide how many.
Okay.
I thought it was tiny.
Facilitating.
I've already called it to order.
Yeah.
We got all of them.
So tab number 7, health services.
Okay. You see the chart, total funding, we've grown in health service from 2008 to 2011, from 145 million budget to 273 million, almost double. Now the big increase step up in 09 obviously is due to the Hastings hospital coming into our system. And just a few comments on these unexpended balances. Some of them look like, obviously they're pretty substantial numbers. 32 million in 08, 12 million is community health preventive services, 6 million is in direct care, 5 million is in capital projects, and 4 million contract health. Now the 34 million the next year that went unexpended in 09, 11 million community health preventive services. Now a significant amount of that community health preventive services is, I believe, is in the diabetes program. 12 million in capital projects of that, and then just a little bit in direct care and contract health. They went down to 2 million each on unexpended. There's a $77 million projected unexpenditure. 30 million of that is the Bonita Clinic. Actually, and as well as 10 million more capital projects. So 40 of the 77 is capital related, which would get us back down to 30. 11 is in community health. Contract health and direct care is projecting out 6 million and 4 million to be unexpended, although the projections for those two items are real difficult at mid-year. Into the funding sources, obviously there's vast majority in HS self-governance. Are seeing a trend of decrease in gen fund and motor fuels from the health department from 12 million in 99 down to 4.5 million. Decrease in gen fund and motor fuels from 99 to this budget of 7.5 million, from 12 million to 4.5. Here's the salaries and benefits. The $7.9 million in new positions for salaries and benefits. 5.6 million of that's in direct care, and about 2 million in community health and clinical support positions. 7 million in vacant positions. 6 of that's in direct care. And the positions, 148 for the new, 107 are in the clinics and hospitals, 19 in community health, and 15 in clinical support, CHS. On top of the 94 vacant positions, 75 of those 94 are vacant in the clinical and hospital. So the direct care has 107 new positions on top of 75 vacancies. Of those 75 vacancies, I would add that 39 of those are at Hastings. There's also 12 vacant positions shown in the budget for administrative support and 5 for community health. Into the departments, the administrative support has no significant change budget to budget. It is $4.2 million or more than doubling compared to 09 actual spending, and related to an MIS department that took a significant increase in 2010, this current year budget, as compared to the 09 actuals. Clinical support services is reducing by 5% budget to budget, but it's 2.6 million or 13% over the 09 spending level. The slight decrease is reflective on the discretionary funded budgets for contract health and denture eyeglasses, and self-governance contract health remains at the self-governance contract health, I want to point that out, still is at the $18 million level for fiscal year 11. Now, the increase over 09 is due to the contract health service budgets exceeding the 09 spending level by almost $2 million. The clinical support department is also budgeting in excess of 09 spending by almost $1 million. Community health preventive services has a $12 million shown as a decrease. It's primarily in the DHHS funded programs, including the diabetes grant for $4 million, the anti-drug network for $2 million, and many paths program for $5 million. Although there's no significant change in total compared to the 09 actual spending in community health, we see increases on behavioral health budgets and one-time economic stimulus funds offset by reductions by that mini path program. The next department in health is the direct care, the clinics and hospitals. They're budgeting $19 million, or 14% increase over our current year budget. A lot of that's due to the positions, as you can see by the table. $12 million is related to capital expenditures, a pharmacy refill center, 7 of that, and Hastings facility improvements for the remainder. The balance of this increase, budget to budget, is spread out throughout all the clinics. There's a $33 million increase over the 09 actual spending level, largely in the Hastings budget, which accounts for nearly $11 million of the increase, with the remaining related to the capital expenditures I just mentioned and operating increases across the board. The department's requesting 107 new positions in addition to 75 vacant positions. I already mentioned that. The last department's the executive director or group leader. I excluded the capital projects out of the comparison with 09 because it was distorting the numbers. But budget to budget, it's a 10% decrease, $6.4 million, due to a reduction in the health equipment replacement fund of $4 million. And that particular fund typically goes up and down based on carryover whenever it comes forward throughout the middle of the year. Then it goes down at the beginning and it goes back up with carryover typically. And the non-recurring startup funds for the Bonita Health Clinic. Although the equipment reserve fund is less than the 010 budget, that fund is still $5.3 million more than was spent in 09. This department's actually reserving nearly $8 million of compact funds for equipment. Again, we're seeing a history of budgeting these reserves but not spending the funds. In 08, we spent less than $1 million of $4 billion budget. 09, we spent $2.5 of a $6.5 million budget, and projecting even larger unspent dollars this current year. This department has significantly reduced or totally removed most of their gen fund requests out of this budget. I think the lion's share of what's left on tribal discretionary funds coming out of the health department is limited to $700,000 dentured night glass, $1 million contract health subsidy to their main program, as well as motor fuel tax for the Bonita Clinic at operating expense for about $1 million and $1.4, and then tribal dollars for the fitness center here in Tahlequah for about $840,000. That completes my review, Mr. Chairman, for the Health Department.
Councilor Peterson.
Doug, help me out. Go over the gen fund dollars that's going into health again. Not so much contract health is, first talk to me about the gym. It's costing $840,000 to run the gym, the gen fund dollars?
It's being requested, yes. Yeah, $839,394.
And it's paid out of gen fund?
Yes.
Okay, why isn't it paid out of compact dollars or third-party revenues? Because it's a preventative measure.
Rob, talk about the IQ.
Yes. Melissa.
The reason is because if it's in our compact or money that's generated from our compact, it has to meet IHS eligibility. And the recreation center is not just open to IHS eligibility.
Okay, how about third-party revenues?
Well, the only one that Medicare and Medicaid also follows that. Private insurance is the most discretionary form. And the reason that we've not proposed that out of private insurance is because our third party, as you all know, we have almost $50 million of debt. $30 million for Muskogee Clinic, and we just signed the loan, as you know, for Bonita of $24 million. And so any extra third party is going to debt service.
How How much did our third-party revenues increase last year? Got it somewhere.
7 million in the budget.
How many? 7 million?
Yeah.
It increased
That's
7
all
million?
third party, yes,
In third party?
yes. And it's all budgeted.
Okay, talk to me about the Veneta Clinic. The operating budget, it's paid out of third party. I mean, it's paid out of gen fund, isn't it, Doug?
Paid out motor fuels.
Portion of it is third party.
1.4 is coming out of motor fuels.
1.4.
No, it's 1 million out of motor fuels and 400,000 is third party.
Out of motor fuels, and 400,000.
Right, and that was a commitment that was made in 2001 when, actually by the tribal council, when we developed those two nurse practitioner clinics to fulfill our long-range plan of having a facility so that no citizen has to travel more than 30 miles. And at that time, and some of you remember this probably, but I was told that, you need to try to work on, in the future, finding revenue sources to move Bonita and Bartlesville over to. Completed that on Bartlesville probably about 4 years ago, and as you know, Bonita, this is the last year we need for Bonita. Next year we'll get IHS compact dollars for Bonita, and that'll be freed up. So,
Okay, so $1 million out of motor fuels, which is discretionary, and the 400,000 out of what?
it's third party. That's what they generate there.
Doug,
All right, yeah.
talk to me about third-party revenues and the 7 million that went up this year, please. Is all 7 million of it going to debt service? The increase in it? What?
I don't know off the top of my head. I'd have to dig into the line items to see.
Because I'm seeing some area here where it's about $2 million in gen fund.
Actually, I got corrected. The budget that has 1.4 million worth of use on motor fuels, they have 400,000 of third-party revenues booked on that motor fuel accounting unit.
Right.
I didn't realize it was actually, so it's a $1 million net use to, I said that right? Yeah, net use to the motor fuels.
Right.
$1 million. And then- Yeah, but your debt service is $7 million.
Councilor Baker.
Yeah, it's budgeted throughout, but, I mean,
Like 400,000 is that going to be each of the clinics?
Okay.
Generate revenue.
I think I'm understanding what you're. If the IHS or third-party revenues or the compact funds were going to be tapped to try to absorb one of these things you're talking about, this $1 million in Bonita, then those budgets would have to make room for that $1 million. Now, you have compact revenue coming in, which have certain restrictions on them. Now remember, it's self-government, so, I mean, we're talking about self-government funds. You have third-party revenues, Medicaid, Medicaid, and private insurance, which have some restrictions on them. I'm not, she can talk about this a lot better than I can. But all sources that I just mentioned are all requested to be expended for what they're asking for. So if you take $1 million more and put into this $270 million budget, they're going to have to make room for it. So something's got to be reduced.
Okay.
But the revenue is spread out all over the place. They've got compact revenues on clinics. They've got third-party revenues on clinics. They've got, they got diabetes. I mean, to try to take these various funding sources and pull them out of the operating budgets and see what's left is a very difficult thing to do. I think it would be much more beneficial if you looked at what do these funds, what can they pay? What can they cover as a whole, not by location by location, budget by budget, and then find out if something else you're interested in, the desire is that either IHS Compact, Medicaid, or private insurance, or whatever source can cover that, the Bonita Clinic, then it's a matter then of what gets reduced over here to make room for that million.
Okay, so third-party
Instead of trying to go
revenue.
at third-party revenue and say, now, okay, now where is third-party revenue going? Where's all it going and who can free up some of their third party? That's very difficult and time consuming.
Because it's going in each facility for direct services.
So Doug, how would you suggest, if I was looking at that, how would you suggest it? You,
Me personally,
as an
I
accountant?
try to avoid that. Don't put me on the spot. Well, I wouldn't want them to cut any existing positions. I wouldn't want them to affect, I'd probably go at new positions that never been funded before. That way you're not affecting, and if they're critical care positions, you might avoid some of them because, it's very difficult sometimes to replace. But I personally, I would focus on new positions that's never been funded before. It wouldn't affect, that's what I would do. I wouldn't affect anyone that's already on board, current operations, just requested new positions. Now, position tracking within our financial system was an upgrade that we were supposed to do in fiscal year 10. There was almost $1 million budget in IS department's budget to implement this upgrade to Lawson. It didn't happen this year. So they've asked for it again to be repeated in this year, but I know I'm jumping groups, but this type of an upgrade, once we get that, we're going to be able to have visibility to a lot of the things you guys have been asking for when it comes to budgeting and tying up funds for position-related expenses that either get vacant throughout the year or we never fill them. And having visibility of that with our system right now is extremely manual exercise. So hopefully we can get our system up to a point where we can have clearer visibility of that type of, because to me, what you asked me, my personal opinion is don't disrupt current operations. If you're going to go try to free up $1 million of this fund, then I would look at some of these positions that have never, they're classified as brand new.
Okay. I'm looking at new positions right now. Yeah, there's 148 of them in the budget.
But here's the problem. If they're classified as a brand new position in a 2011 budget, they never have been contemplated and funded in this year.
Okay, there's close to $8 million.
Then they weren't filled out right in the budget.
Thank you, Mr. Chair. First of all, the position tracking that was requested in the 2010 budget is in the process of being implemented, and I believe I reported on that at E&M. The target date for that to go live is September 26th. That is the HR piece of it, and there's a budgeting and reporting piece that will also be implemented. As you're all aware, buying a new piece of software doesn't mean it instantaneously is up and running. So we are working on that, and I think it will be in place before the 2012 budget. I mentioned in my overview that a lot of these positions that are listed in the budget as new positions were really submitted in mods during 2010. So that's why I took the payroll worksheets and compared those to where we are with actual employees on staff right now. Yes, there are unfilled positions, vacant, or there may be a few new, but I have a list of actual positions that are not filled as of middle of August when we did this report. So there is some distortion in the budget because it may be listed as a new, and it may actually have been one that was submitted with budget modification. And in health, it's further complicated by MOAs and IPAs who are listed in the budget for Hastings as contract, and then if one of those leave and we replace it with a tribal hire, you're moving from the contract line item up to salaries and fringe. So there are 213 open positions based on this report, and Melissa can address those.
Okay, Doug, I realize that it's gonna be distorted
Right, isn't that
and
what it said?
complicated. Excuse me. I realize it's gonna be distorted and complicated, the open positions, but I'm looking at new full-time employees, and I'm looking at $8 million. I'm looking at vacant positions. I'm looking at $7 million. I hardly think it's distorted $15 million. I may be wrong. Maybe our tracking
No, I
system's
think
off
she just
15.
reported it like 120 something.
Okay, so
Or-
there's some play in there. We're holding some money, and I'm gonna be real honest, I call it sandbagging, folks. We're sandbagging a heck of a lot of positions, and we're sitting here on this money, and we're not filling. We're telling the people we are cutting services, and we're not helping our people. Why? Because we won't sit here and hold the money for people we're never gonna hire. That makes absolutely no sense to me when we can take $2 million out of here, out of gen fund dollars, use some of these salaries, some of these compact dollars, third party, what have you. You cannot tell me that can't be done, and we can't do more for our people. Doug, am I wrong? Can we not, is there not some play in this money? No, Doug.
Well,
I said Doug.
my personal opinion is, I think we can. I don't obviously know the operations of the health service group like they do, but from what I've seen, we just got a report from the treasurer's office on quarterly vacant positions from quarter to quarter to quarter. I gave that to you this morning. What does it say for health group has been remained vacant throughout every quarter of the fiscal year 10? And what's the dollars associated with each quarter of vacancy?
Are we talking about gen fund? Are we
You
talking
wanna-
about discretionary? We talking about
Discretionary
all
is where you would
funds?
find it.
Okay.
Just for health service.
133 beginning, the first quarter 124 employees, the second quarter 68, third quarter 127, for a total of, on this discretionary loan, I'm looking at $5.5 million.
Just for health, what are those four added up to?
5.5.
5.5 million?
Off the top of my head real quick.
That's fiscal year 10. That's real. That's not a budget. That's real experience in the year we're just ending right now. That's how much vacant positions is in here. So you ask me, can this thing absorb $1 million? Sure. I mean, based on past experience, but where it would come from, I would...
It wouldn't matter where it comes from. It can
That's
absorb it. It can spread it all out. It won't matter.
why I said vacant or brand new positions is where and I realize I'm getting put on the spot here, but that's the way
I'm
I
not
think.
gonna put you on the
is-
spot, but
That's okay.
I'm
I mean,
running
that's
back
the way
point
I
here.
think. Is I go to where it hadn't been needed before. I can't justify is it going to be needed in the future. That's their responsibility to do that justification. But I just look at where's opportunity, where have we earmarked money and not used it historically.
Well, new positions, it's never been used on because there ain't been no need for it. And I've been on this council 3 years, and I have yet to hear a good reason from anybody why we sit on money and sandbag it. Kelly?
Well, first of all, I'm a little offended by saying I'm sandbagging. I used to play spades and I've never been a sandbagger. When we put these budgets together, part of that, a critical part of that, is the staffing plan. And to have budget authority to hire that staff, you need those staff listed in your staffing plan. It's a fact of life that we have turnover, and that is correct. Our turnover is about 12%. Health has a lot of hard-to-recruit positions. That doesn't mean they're not needed. So if you take them out of the budget, are you taking away the budget authority for them to recruit those? If we take out a dentist, and then all of a sudden we have an opportunity to hire a dentist, we don't have the budget authority to do it. It is somewhat a philosophical discussion, but yes, there are vacant and new positions in the budget. When you operate a program, especially one as large as health, you need to have some flexibility to manage your program. We put these group leaders in charge of these programs for a reason. They are experts in their field. And I just don't think we should be saying we're sandbagging. It's a planning and a staffing need. Whether those people can be recruited, there's all kinds of factors that'll impact that.
I still have the floor, and I'm going to say it again. When you're talking about recruiting these positions have been empty since I got here, so don't even start to insult my intelligence. Number two, you're talking about recruiting doctors. I got a surgeon for her sister. She goes and interviews, They say, we'll give you $300,000, we'll give you 10% of every operation you bring in the hospital. You get $10,000 more every year you stay down here. If you got a kid, which private school you want him to go to. And by the way, we'll give you a house loan at 0% interest. That is why we have a problem filling needed doctor spaces. Not to mention, she needs to take a 50 to 70% drop in pay. Now, there ain't nobody in this room that would take a 50 to 70% drop in pay to come work here. Let's be for real. Ain't nobody going to do it. We're asking doctors and dentists to do it. It ain't going to happen. And I still say, folks, we're sandbagging it. I don't care what you call it something else, but it's still going to be the same, folks. It is what it is.
Melissa.
Thank you. Two things, well, three things. First, all of our money in our budget, including the vacant positions money, the salaries money, is used for direct services. Our new positions are direct services, except for about 10 of those, which are IS, which you have to support your direct services. The second thing is that in the Hastings budget for FY11, we only budgeted all of our salaries at 95% instead of 100%. And the third thing is that we have to pay, for example, in Hastings, we're down 9 or 10 RNs right at this moment in time, and I went through this yesterday. We have to hire a staffing company to provide those RNs for us until we can get those positions filled. We just recently, and my finance director is here, recently, as in the last 2 weeks, had to move money from the staffing line item over to the contracts line item so we could pay those staffing dollars. Those staffing dollars we had to increase by $4 million. So some of that vacancy money is still spent on staffing, but we move it over to the contract line item to pay that. And for the FY11 budget, I only actually have 41 new positions, and I can tell you what they are by position. But those other positions were Salina Dental, which we're building dental right now, so it was the staffing pattern for Salina Dental. It was the staffing pattern to expand dental services at Three Rivers Health Center. And also another big ticket item was to provide the staffing pattern for the central mail order and refill system that we're developing and putting in. So there was at least 3, and then we're adding a physician at Veneta now, so we can get ready for the move over into the new facility, and adding another staff person there, I think 3, to get ready because we're in the design phase of that. So I just want to say those things about staffing. And then, again, the Veneta Clinic, this is the last year that we need funding that, because we've been able to secure a joint venture from IHS for Veneta starting in FY12. And that's all I have. Thank you.
Okay. Councilor Critt.
Thank you, Mr. Chairman. Melissa, health, if staffing was affected adversely by any funding, health would be the last place that I would hope to see anything like that happen. That's my number one priority. But the other thing is, Mr. Chairman, as group leaders, when you supervise a bunch of people, I mean, you know when you need to hire a new person, okay? And you know when you've got a vacancy. I'm assuming a vacant position means one that was filled, possibly, that somebody quit or you had to let them go. Or,
That's right.
And then you look at it and say, do I need to fill this position back, or can we huddle up here and take care of things? I got to believe there's some dollars that's been sort of earmarked for vacant positions, and some of these positions may have been vacant for not just in the 2011, but they might have been vacant in 2010, and I've been even vacant in 2009. If that's the case, I would think that a group leader could actually honestly say to whomever, I've got 10 vacancies here or whatever. I need to fill 2 of them, but the other 8, I can do with that. okay? Seems like we could, you know, we wouldn't take a group leader, or if I was managing, you know, a little group of folks, and I had 5 vacant positions in my group, I think I could tell somebody real quick what I really, really needed to fund them or not for this year, this coming year. And if that's the case, however many of them that I absolutely didn't plan on filling, that money could then be loosened up for some of these other things that we've been talking about. I mean, is there any way that of course I'm just talking to the health group leader, but I'd like to see somebody address that just a little bit, you know?
I apologize. You're talking about the staffing for the overall
Yeah, for the
budget?
overall county. Now, each group has
Each
got,
group.
they've got new positions. I'm assuming that's a position that's come up for a needed position.
Right.
It's never been filled.
Right, other than this issue that we were
Yeah.
talking about, where as we go throughout the year, positions are added
Yeah.
through budget mods, and then when we get ready to do the comprehensive budget, those spreadsheets, because it's a manual process, haven't been updated.
And I'm
So
just
that's
thinking-
why there's some differences between what Melissa has as a new position versus vacant positions. And, I mean, this is what I was talking about. Every group has a staffing plan based on the needs. And that's what generates the payroll worksheet. That's what generates the budget for that group. And they manage to that budget in terms of their staffing.
Can I respond, Mr. Chairman? All I was saying, Kelly, is if I'm a group leader, or somebody's a group leader,
Mhm.
and they've got X number of vacant positions in the 2011 budget,
Right.
I mean, okay, the funding has been set aside for those in case they're going to fill them, all right? Now, I, as a group leader, ought to be able to tell somebody, well, I've got 10 vacancies here. They were vacant last year, by the way. Maybe. I don't know if they were or
Right.
not, but they could have been.
I mean, most
We-
group leaders could tell you
These
that.
things kind of roll around a little bit like that from year to year. Realistically, as tight as things seem to be, someone could ask me, well, are you really planning on filling those? If I said, well, it'd be nice if we could, but realistically, probably not.
Yeah.
That money could then be rolled into the gen fund for other uses. Some of these.
Well, it depends on the funding
Right,
source.
but in
Right.
some cases it could.
In some cases, if you had a vacant position that's gen fund and that wasn't needed, you could eliminate that vacant position, which would free up some money.
Yeah, because some of these new and vacant deals might be kind of like a wish list, you know what I'm saying?
From my perspective,
Maybe not.
I don't think there's much wish list in this budget. I mean, we started this process back in April and spent months of
And
going
then-
back and forth to the group leaders.
And then I guess I would have to ask a question which makes sense to me is, if we put all these 400 and however many people to work today, where are we going to put them?
Well,
Ten?
there's all kinds of places where they would go. A lot of them, as you've noticed, are health clinics.
Huh?
And, I have, I believe, 10 vacancies in my group, primarily in acquisition management. We sorely need more staff there, and we're actively recruiting for those. We would put those in the finance building. So each group has
So
facilities.
we got room for them.
As far as I know, because we are so spread out now across the 14 counties. These staff the vacancies are throughout 14 counties in all of our facilities.
Okay? Thank you, Kate.
Councilor Calhoun Wall.
At this point, it's no longer relevant. Thank you.
Councilor Jordan.
This is probably a question for Melissa and Doug. Where would the recruitment portion of your money be in Doug's budget, if you could tell me that?
Does it have a two separate IDs?
Melissa, how much do you allow for recruitment?
We have 2 staff, and that's funded out of indirect cost pool. Okay? I'm
I
sorry.
guess I'm asking about the contractual part where you said you contracted with various entities to try to get nurses?
Well, that is staffing companies. You know, the companies where you call like locum tenens, PRNs, and you say, I need 3 nurses to work tomorrow night shift, and they send you those 3 nurses.
Okay.
So that's paid out of the contract line item of that facility, and we move money from staffing down there to do that.
Okay, well, here's what I'm getting at. Here's my kind of my vision. Right now, we're using $467,382 for the Directed Studies Program, which is a 1010 number, which is all tribal funds. And a good portion of that is to grow our own health people. Because when they enter that program, as I understand it, they contract to come to work for us.
That's correct.
What I'm trying to figure out is if there's any way, because of the critical shortage of our tribal funds this year, if we could use some federal funds through the health department to fund the Directed Studies program. Because we're actually growing these people to come to work for you all. And I didn't know whether that would be a possibility under recruitment, under contractual services, or I know you would know best where maybe that could happen. But I see that as a way to maybe free up a few dollars in this critical time where we could maybe use those tribal dollars for another service. And I know this is way above my head on health, but I have a feeling since we're growing those people for you, would that be something that you could help us with and find somewhere in your budget that we could absorb some of these dollars, which would be federal dollars, and then we free up our tribal dollars? I just thought, I'm wondering if that's a possibility.
Let me think on that just a second, because it may be.
Because I know we want, a good portion of that is nurses, because we've got some great young people coming to you all.
And we've hired every nurse every person that's come out of the nursing program and education and the Directed Studies program has a job, and it's been a
I'm so high on that
great.
Directed Studies because it's almost all health, and I know you all need those health people. But I'm wondering if there would be some way we could use some of your federal dollars to accomplish that, and then that would free up some tribal dollars.
Let me do some
If you
research
could-
and see.
If you can do
that's a
that, then I think we'd have some tribal dollars for some other critical direct services. Now, we might need Melanie in here to tell us exactly how many of those dollars are going to the health area. I'd say it's a bunch, but
I assume you're talking about the Directed Studies program?
yeah, how many of those kids do we have that are they're going to come into the health field per their contract? I think Melanie would have to tell us that.
Yes, I can get that information
If
from
we could
Melanie.
get that information and then work with Melissa, I could see that possibly we could take some of those federal dollars, which we want to use first anyway,
Right.
and maybe free up a few of these tribal dollars that we could maybe then use for some other services.
Okay, I will check into that and see if I can get a number on how many of those Directed Studies participants are healthcare
I know a
related.
lot of them are nurses and techs, and it's a great program.
Yeah.
Maybe if we could do that before we make a decision on health, that would be great, if that's a possibility.
Councilor Pigeonwell, your second time.
It'll take a while then, Joe. At Wilma P, I promise you all, we've never run on a full staff. Joe, have we? Harley, at Sam, you and Curtis have Sam Hyder. Have you all run it full dentists and full doctors ever that you remember? Or do you still get calls wanting a permanent drop-in doctor? I get them all the time. Three Rivers evidently is going to be a 24-chair clinic dentist, and I'd like to find 24. I'm sorry, folks, that's a little bit much. That's a lot of wishful thinking if we think we're going to have 24 chairs over there full of people getting their teeth done. I don't understand. You're at Salisol, David. Do you all run on a full
I
employment?
need mine done.
You might go. Might go over there if they got that many dentists. What I'm saying is, I'm looking at an actual report here. The first quarter, 1.5 million. This is just discretionary. Second quarter, 1.5. You know, another quarter, close to 800,000. That is what we've held and not filled positions with. And this is just discretionary. This isn't everything, folks. And I do not know why we're using gen fund dollars to do Marcoma and part of Benita when we can shift it over there to these compact dollars, spread it around, however you want to do it, and get back a couple of $1 million in gen fund so we can provide services for the people. I do not understand why one would even have to argue over it, is the point I'm trying to make.
Councilor Baker.
Yeah, Kelly, last year we loaned Benita Health Clinic $800,000 out of gen fund to do some utilities. Was that paid back with the construction loan?
No, not yet. It was in the 2010 budget. I believe it's $598,000. The assumption is in 2011 that will be paid out of the loan proceeds. I don't believe any of that money has been expended yet. So in effect, it will generate some carryover for next year if it does not get expended.
So they didn't do the utilities?
They've been doing some planning. Do you know where they are?
That's Angie Drew's budget, but I do know that for FY10, they are in the process of doing that, but they haven't been able to expend, I don't know how much money out of that, but it's not all of it. In fact, we're going to pick that up. So
In
it wasn't a
2011.
request for FY11.
Right.
Okay.
Health is going to pick that
I
up.
guess my question is, are those dollars in this budget?
No, they are not in the 2011 budget.
Health is going to pay
They
for
will
that.
carry over,
It will
So they're-
carry
but
over.
they're not identified in here.
Right.
So, but we could almost identify that 600,000.
I'll have to go run some reports and make sure that nothing has been expended from it.
Okay.
But, I mean, then we go,
All right.
we're getting into the carryover, it's already budgeted, et cetera, et
All
cetera.
right, very good.
Councilor Hostel.
I will go.
Councilor Thorne.
I just have a question for Melissa, and
Sure.
some of this I don't understand. Do we have any PAs, physician's assistants, in our budget? Do we have RNs, LPNs? Okay. Are any of those people, do we ever bring any of them in on a contract for like a month, 2 months?
And we pay
We
that
pay
out
them
of
very
the staff.
dearly for that. It's real high. And what I'm saying is some of this funding may be going for that. That we're budgeting for FTEs. And the reason I brought this up is because I know a registered nurse that works private sector in my area. And Cherokee Nation pays RNs more than what she makes in her private sector. But she can go to California or New York and work for a month, or Hawaii. They got that. And work for a month and make more there than she can in 4 months working down here. So I didn't know about the contract part, and I'm happy to find out about it. Maybe we can get somebody to contract up that way instead of our way, okay?
I've
But
been
anyway, that's
working.
all I was wanting to know. I knew there was a large expenditure there on that contract here.
Councilor England.
Thank you, Mr. Chairman. Melissa, this may be for you, but for current employees, Cherokee Nation employees that are under grant, do you have a priority for them? Their grant is running out. So do you have a plan for them? A priority? Okay. Okay, thank you. That's all I have.
Councilor Jordan.
I would like to give Melissa an opportunity to see if this directed studies idea could be fleshed out. If we took just a short recess before we left health and give her that opportunity, we might we might find that we have a few tribal dollars that we could use if her dollars could be used towards that idea. And I would like to give her and Callie and the powers to be here an opportunity to flush that out before we leave health. So I guess what I'm saying is, could we have a 10-minute recess so that they could maybe flush that out?
But the question, can they?
I don't know that. I mean, it's going to take us a little bit of time to do that. I'm not sure that 10 minutes is going to be enough time.
Because remember, we can, at the health committee, this could be addressed anytime during the health committee during the year.
Well, but I would like to do it within this budget if we could. Possibly then we just recess on the health budget until an hour or so and let you look and see if you could do that. Okay?
Okay, well, first I have Councilor Calvin Watts.
Thank you. I'm glad that we're having this discussion. Really, we should probably have it every month. But I'm not quite clear how we can, I mean, really we need to be coordinating health, education, and career services. But the amount of time that health has asked me to spend in D.C., this actually, I mean, when we talk about economic development at the individual level and uplifting families, these kind of careers would do that. They would change entire families' lives with the amount of money they could make. When we talk about our health disparities in our communities, the root of that is having our own people serve our folks as technical medical providers. So I hope we continue this discussion. I don't know that we can resolve it here at budget time where we have the most power as the legislative branch with the power of the purse. But we do need to refocus and we need to guide our citizens into these careers, because when we talk about healthcare reform, it's not just the health disparities where folks who don't know how to service and can't relate to us because they're not Cherokee as providers, but the healthcare reform issues are there aren't enough Dr. Brad Cobbs and everybody else out there in the world. I mean, even in private practice, there literally just is such a demand that there is not enough medical providers at every level of the chain. So whatever we can do as a body to start focusing our education and career services dollars and even health dollars, I think that's a great idea, Councilwoman, that if there is a way we can refocus this and start spending that money to further these individuals in these career paths, we have got to do this. So I hope this discussion doesn't end today. And if there is a way to resolve it, I would support it for even a part of it. Thank you, Mr. Chair.
Okay. And we will, if requested, we can come back to health at a later time. And Doug, we'll let you.
We probably need to give Melissa kind of notice when we're going to come back, though. Is it going to be so that she can be here? I don't think she's probably got other things to do. Are we talking an hour? Are we talking this afternoon? Or are we talking tomorrow morning? And I would defer to Dr. Call on that.
This may be premature, but we need to maybe interject a comment into that. Do we think we're going to be finished today, or do we need to possibly have them be ready for tomorrow? You're the chair.
I have no idea. At the rate we're going, we'll be here tomorrow, but I have no idea.
You still have the...
Councilor Buzzer.
Yeah, I just, Melissa, you can answer this question. On the Community Rec Center, what is $839,000? Where's those projected dollars going to be used, and what's it for? The Community Recreation Center, $839,000. What is that?
It's for operational dollars for the Mel Seminary Recreation Center. It's for we have $300,000 in salaries and wages, and that's for all of the instructors. You know, we offer all kinds of classes there. We have all kinds of athletic leagues. That's for that, and then there's $78,000 for fringe benefits. $35,000 for contract services. A few of our, like aerobic instructors are on contract, and so we pay those out of contract services. $20,000 is for just supplies for the center, whether that be, toilet paper, office supplies, whatever supplies you need for a year to operate the center. Telephone is $900, and then space cost, which we pay the allocated space cost to the tribe for the facility is $293,000. And that's the budget.
Okay, thank you. And just a comment on that, I'm not against having these rec centers like that, but I think as I've said on the council there for the last 3 years, that it just seemed like everything go on the telephone. You're looking almost $1 million. I'd like to have a rec center in Delaware District, and I'm sure they would in Mayberry District, I'm sure in Washington County. I don't know, those are tribal dollars, and I'm really, and I know it's needed. I know our goal is to have healthy people, but we'd like to have healthy people up in Delaware District and Adair District and Washington County also too. So I don't know. I just want this committee to think about $839,000 where it's going. So that's just my comment about that particular line. So, thank you.
Melissa?
If I could just give you some numbers. We have 9,000 members at the Recreation Center. 6,000 of those are tribal members. 2,900 are non-tribal members. And we had 10,412 visits in the month of August. Thank you.
Dr. Collins?
Just a couple of questions. First, you may just, I know you touched on it, but address it a little bit more. There's a reason when you're talking about Gen Fund and then versus other dollars, why that is specifically done that way, and it has to do with citizenship and non-Indians, and you may touch on that a little bit more. But the second thing is non-citizens or non-Indians. There's a fee. There's a fee.
Mm-hmm.
Where does that go, and do we see that in there?
Yes.
Okay. Those are my two questions.
Yes, it's shown as income in the budget for that facility. We offset by the income, yes.
But the first
And the first part is, which I mentioned a while ago, that the reason it was funded out of general fund is so that we wouldn't have to meet IHS eligibility guidelines. Because it was for, it's for prevention for families in the community. And as you can see, 10,000 visits every month. So definitely lots of families are getting some long-term benefit from that.
Councilor Fisher-Call?
Okay, when they said that it was funded so that way so we wouldn't have to meet IHS eligibility guidelines, do we not meet them now?
Not for the recreation center, because it's out of tribal money.
I mean, would it be a problem meeting them if we use the compact dollars?
Well,
self-government?
Yes. I mean, the problem would be is that there would be at least 3,000 people from the community that could no longer use the facility.
Why would that be, I'm curious?
Because they wouldn't be eligible for IHS. And maybe even more. I mean, that's just a guess. We'd have to go through each person and see what their eligibility was.
What would make them 3,000 not eligible? I'm confused.
Well, because I can tell you that there are 9,000 members, 6,000 of that, and this is self-reported, that's why I say that, are tribal members of some tribe, okay? And 3,000 of those are non-tribal members. They're members of the community. They're family members of tribal citizens, and automatically those 3,000 wouldn't be eligible. But there may even be more of the 6,000 that's not. I don't know. We'd have to go through the eligibility with each one of them. Does that answer your question?
So the non-Indians, we wouldn't let them use our facilities?
That's correct. just as we don't in any of our other health facilities.
Melissa, I'm curious, is there a way that you could see giving up a couple of $1 million and funding some of this out of your own money? Let's say the salaries, the compact dollars, and giving up gen fund to the pool since the times are hard and everybody's doing their share?
Well, I feel like that health has done their share. We have decreased $6 million in general fund this year. I mean, we did have $10 million of general fund for direct services. Now we're down to $4 million, I think. So we have decreased. I mean, we definitely took a much bigger hit than any other program in the tribe. And all of ours is direct services to tribal citizens.
Okay. Councilor Kevin Watts.
Thank you. Melissa, I remember at one point during a budget modification, I believe, to catch up on last year's budget, we were to begin charging fees of some kind of minimal nominal fee or something to collect revenues to offset the cost. At Marcoma.
We do collect these.
Okay, so what are they paying and who's paying what? How much is generated that it's self-sufficient?
Okay.
We haven't talked about that. That's part of the picture missing, I think.
Okay. Previously, until up to, I'm going to talk a little bit of future, but October 1st, okay, in FY10 and previously, the fees are $15 for students, $20 for individuals, and $30 for a family, unless you're a tribal citizen, and then it's free, okay? Those funds have gone into an income account that has offset the recreation budget. That's about $55,000, and it's in the FY11 budget. So that's already in there as part of the revenue stream for the recreation center. Starting October 1, because we've had to, there's been so many crunches on general fund money, we are going to probably have to increase those fees a little bit, and we're in the process of trying to decide what that's going to be, and we've not made any decisions yet. But in FY11, it's $55,000.
I mean, I guess one of the things I've always been concerned about is not that I don't want to provide that, because I think it's definitely effective. It seems like there's always people there and people use it. But, I mean, we don't offer it in all of the areas. And I thought one of the problems was, one of the general philosophies was if we could not fund it for everyone or provide it for everyone, that it wouldn't be something that we would really pursue. I'm curious, like even if you charge $25 for once a year for a person to the tribal citizens, because I know Rogers County, Mays County, we don't have access to that. That'd be $225,000 we could collect in revenue, offset the $1 million. I'm just trying to balance the overall need to represent the whole tribe and not just Cherokee County.
Councilor Jordan.
I would like to table further discussion on health until tomorrow at 10 o'clock. I think we've thrown out a lot of ideas here today that I know Melissa probably needs time to investigate whether there's even possibilities that some of these things could be accomplished. So I would make a motion that we table further discussion on health until tomorrow at 10 o'clock.
First, I have Dr. Cobb. So if
Yeah.
I just made before the
Real quick interjection, Melissa, I want to expand on Councilor Watts just a little bit. I'm not trying to put the YMCA in the business of Bartlesville by any stretch of imagination, but that's something to think about down the road, because I can tell you right now, the fees that we would charge a facility like that in Bartlesville, there's no way that the Y or any other place in Bartlesville could match the fee that we would. I mean, there's no way. I mean, it's 300 and something. I mean, and I would defer when I was younger. I I would defer to Madam Speaker. She actually worked at the YMCA, so she has a pretty good working knowledge of that.
It's expensive. Plus you have your volunteer, sorry, Matt. Plus you.
I just defer for a second.
You have your volunteers that come in to offset some of the salary expense. That's expensive to do this. It's going to take some long-term planning on that if we spread out to the different areas. But I agree with her. It would be nice to have them all covered.
And I just, well, I saw the
Now,
floor.
look at Councilor Jordan's motion.
I hope we'll consider it because
Okay, your motion is that,
to table further discussion on health till 10 o'clock tomorrow, to give Melissa time to look at some of these ideas that we've put forth today.
is there a second?
Did you get a second? Second?
Okay, the motion's been made and seconded that we table health until 10 o'clock tomorrow morning. All those in favor say aye.
Aye.
Those opposed? Aye. Pardon?
You want to talk about it?
How many no's did we have? 1, 2, 3, 4. Wait, 1, 2, 6, 7. Okay. And how many yeses? 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. All right. So health is tabled until tomorrow at 10 o'clock in the morning. Okay.
15 minutes?
Okay.
What are you going to do next?
We will start, is the chief's office,
No, unfortunately,
we will start with item 2, tribal council.
are we
And then
just
following that,
are we going to go in order now so I can lay?
I'm planning to go in order
Okay.
unless someone has any other request. Otherwise, we will go in order from here on out.
Okay.
Have your chance. Okay.
Okay. The council budget, the tribal council, 2.6 million, compared to 2.7 in the current year budget. And that reduction is largely due to the donation and contribution, $150,000 budget that you guys have a subcommittee on, is not in the 2011 budget. There's a significant reduction, obviously, from '09 when the community assistance and legal fees were removed. And when you look at it by funding source, you can see the impact of those two things I just mentioned there in the on the general fund budget. There's a few vacant positions that are still unfilled. There's 2 vacant. There's not any new. And any questions? Those 2 positions have been in here for quite a while. Systems administrator and a public relations, public and an IT person, yeah. The budget was submitted flat with the 2010, no changes. I would comment on one thing. The intertribal council, or excuse me, joint council that occurred in this current year here, we don't have that expenditure planned for next year on our dime. So I didn't submit a Legistar host fee budget, which would be approximately $30,000 and really close to approximating what we spent on the joint council. So in an effort for the council to take some initiatives to reduce funding or reduce spending in this tight budget, then by keeping it flat on our operating budget, I just shifted what we did spend on joint council over to try to absorb that host fee burden for Legistar out of our operating budget. And then the donation contribution not being in there. Would point out that your Your carryover for some of your projects are going to be coming forward. Those budgets are going to come forward in Mod 1. Since we don't, when this budget was done, I didn't try to even come close with some estimate of what law enforcement and I think the bridge or the fuel tax roads, what the actual carryover is going to be. So once we get in a week or so, Michael Lynn and I have a meeting scheduled where we're going to get together and make sure that all of the project-related items that you guys obligate out for law enforcement, roads, bridges, that the adequate carryover is put in right at the beginning of the year, early in October in Mod 1, so we don't end up with a situation like Mr. England about got into with a project where we waited halfway into the year to get all the carryover on the table, and I think he may have had a county commissioner may have had to wait a couple of weeks longer than he would have desired. So we're addressing that in the front end. That's Group 2.
Any discussion on Group 2? Tribal Council. Is the chief's office, Council Thorne?
I have a question about, Doug, community meetings, is it in the budget?
The client service line item funded, correct me if I'm wrong, $1,500 per counselor, with an extra $500 for a counselor that was in a single seat district that represented multiple counties, correct? Like, for instance, your case, I think it's $2,500.
Is it still in the?
That is in here. The community mailing budget is not in this budget. Okay, you need to make sure that report I handed out earlier this morning, you probably need to take a look at that, because some of those things affect this branch and what you were accustomed to this year. So the answer yes to the community where you buy supplies for your community meeting and food or whatever. Yes, that came out of our operating budget. That's still in there at its same level.
But the mail out's not.
Mail out is not contemplated in this budget. It's been zeroed out.
Thank you, Mr. Chairman.
Sure. That's great.
Thank you, Mr. Chairman. Doug, those two vacancies, they've been vacant for a long time.
Yes, sir.
Do you know, have you heard, are we going to fill those this year? Maybe?
2011?
Yeah, 2011.
Hope so. I guess you're asking the wrong person.
I know, but we just to make a point. These are some of the things that I've talked about in some of these other departments that are in a recurring type situation. We're looking at $150,000 right there, roughly, I suppose, or somewhere thereabouts. It just keeps going, from year to year to year, and we haven't filled them. I think you all need the help, probably, and that's my comment, but I don't do the hiring. But if the other departments are that easy to figure out, are we going to fill them, yes or no? And if we're not, if it's gen fund money, we can pull it back, let's pull it back and spread it out and put it in services. That's all. I just wanted to make a comment there, Mr. Chairman.
Okay. Councilor Buzzard.
Yeah, this is just a comment, and I'm going to bring it to the attention of the committee and the council members. It's on the dollars that were eliminated for attorney fees. If I hadn't had attorney fees this time, I would probably file a lawsuit over the district, and that's our prerogative if we want to do that. But I didn't have the money, and I don't have the money that I make from tribal council paid out of my pocket. So I just want you to think about that and keep it in your mind when we actually go back and look at some of these dollars. And I'm sure that there are going to be some lawsuits that's going to be filed, in the next year or two. And if you're sitting on the council, and I don't know if I'm going to be or not, but I certainly need to think about that. Anyway, that's just a comment. Thank you.
Okay. Dr. Jordan.
Well, if we are going to have our community meetings, we have to have a way to notify the people. And if we don't have the mail outs, how do we get the notices out to our people about the community meetings? Those go hand in hand. You've got to have both of them to have a successful meeting. Word of mouth just doesn't cut it. And as big areas as we're now representing. And the little flyers on the storefronts is not going to get it because we're going to have to drive 300 miles in a circle to try to put them little flyers out. So I sure think we're going to have to put some money back in there for notice to your constituents that you're having the community meetings and getting the apartments or departments out. And I just throw that out to you for consideration. I mean, you can't have one and not have the other. It just, with 5 districts, folks, your word of mouth's not going to travel fast enough to let the people know you're having a meeting.
I would just like to add one thing. That 10-10-547 is the accounting unit we're talking about. If the decision by this body is to fund in-area community mailing, I believe is what it's called, put that accounting unit underneath the tribal council. I talked to Callie about it. We've got halfway into the year. We've got requisitions and purchase orders hanging out for postage and copying costs. And we went through a little situation. I just think that accounting unit, if it's for this body's mail out, then it ought to fall under this body's budget.
Do I still have the floor, Mr. Chairman?
Oh, I'm sorry. I didn't mean to.
No, that's okay. I would have, Kelly, don't leave. Is that 46,000 still on the table? The 46,000 surplus?
Yes.
But because there's no need having community meetings if you can't give notices. There's just not, folks. It just won't work. And I would make a motion that we take a portion of our surplus and place it in the tribal council's budget for in-district mail-outs. And that would take that line item 1010547 from wherever it's at now and place it in the tribal council budget. And how much Doug or Meredith recommendation on how much that mail out amount needs to be, and that's for in-district now.
Okay. This budget was one of those reconciling budgets in Mod 6 when we were adjusting that $9 million reduction of dividend, and it went from 80,000 down to 32. We didn't have any problem spending 32, and probably got some obligations of some upcoming community meetings that may even exceed the 32.
Well,
So
right
I would recommend at minimum 32.
Information that's just for the mail out.
Yes, ma'am.
Okay.
I would make it as part of my motion then that we take that 46 and put it in the mail out 10-10-547 and that 10-10-547 be moved to the council budget.
Internally, we're moving money within our own budget.
Well, we have 46 to.
That AU, I would just leave it in that AU, but instruct the treasurer to move that accounting unit underneath the control of Division 02.
Well, that's what my motion was right there. That's what that was. That was what your second was? Okay.
But it's a 46,000 that was surplus in the budget, which will.
We're going to drop it into 10-10-547 and then let her internally move it over to the right place.
Question and an observation. Why do we need a whole separate accounting unit just for postage? This is, well, for mailings. Could it just be part of council's operating budget?
That would be fine.
I mean, administratively, it's just another
Point of
accounting unit.
information, I think we need to either, I want to hear from both the speaker and the chair of ENF to answer that question then.
I have no problem putting it in the operations fund unless you see an objection.
No objection other than we need to identify that we have that amount in the operational fund, yes.
Well, and then the second observation, obviously we do have a little bit of surplus on the table, 46,000, but tribal council budget has historically been underspent as well as a lot of our other budgets, so.
Okay. So the motion's for the 46,000 surplus. Go into that. The motion's made, and there's a second. No, discussion on this. Okay, Councilor Thorne.
What I'm mostly thinking about is this coming year, we're going to put $46,000 in there. And I know in my district, we usually try to have one meeting a year. Some districts have 2 meetings. I'm sure that we'll get as many meetings as we can this year before December. And we're talking 2 or 3 mail-outs now. And I'm sure that each one of you will probably do the same thing. And how are we going to divide this money up? Are we going to include the at-large counselors also?
No.
We're not
For
including them?
in-district members.
Okay. I'm going to tell you that this budget we're going to go over this budget within the 14 county districts. So, you need to think about that. 46 may not cut it. And I don't want to miss a mail out because we're out of funding. But if we know how much funding we have, we know how much we need to send out, then, if we evenly distribute it throughout the districts, well, that would work for me. And just to have a mail out there and have everybody jumping in there and mailing out of it, well, I think we got a problem. I think we need to, decide that right now. That's distributed between 15 different councils. That's my thoughts.
The previous budget was also allocated out by council member, I believe. I don't believe it was by district. I think it was by 15. Wasn't it?
Okay.
And we can track it by 15 if you want to keep it just the way it is.
We didn't use all our money. It will be used this year, I guarantee you.
We manage it whether it's in a separate budget or part of ours at that
And
point.
if you don't have the sense to know why,
Then, does your motion want to include that it is to be divided equally among the 15 council members? Or not?
I just want to get it in our budget, and then I thought maybe let's see where we are a month from now. I'm not inclined right now to split it into 15. I'd be more inclined to split it into 5.
the other thing is be more inclined to have it. Put out 13,000 in my district alone, Cherokee's. And I don't know, in the past, what kind of list have we used to send it out? Just the list out of registration, or we used the list out of the voter, the voting list? So I don't know. I've never known what list they actually use.
For community meetings, it's normally for registration.
Okay. Good.
Councilor Baker. Okay. On the motion. Okay. The motion is that we take 46,000 surplus add it to the tribal council budget for mailings in the jurisdictional area,
In your
in the operating budget. Any further discussion? Councilor Gardner.
In Muskogee, we kind of overlap that line that you mean I can't mail across town, or you said inside? How about contiguous area? Can't do it?
Well, the mailings would go to whatever your district is that registration has. And and these mailings are only within the
Okay, I see your point.
jurisdictional area.
Okay, thank you.
Okay. All those in favor, signify by saying aye.
Aye.
Those opposed? Okay. Motion carried. Okay. And before that, I had Councilor Fisher-Goff and Councilor Sutler are operating. Okay.
Okay, Doug, our money for our community meetings is still in there, right? The 1,500 each?
Yes.
And that's all that's in there, 1,500?
That is already in our operating budget.
Okay. I know I had talked to Joe and some to Harley and Curtis about these meetings where we're having to educate people on these new 5 districts. And to be honest, I'm wondering if that's going to be enough for us to educate our people and let them know where they're going to be. And I'd like you all to roll it around in your head. Maybe we can come back and visit it. But we're going to have to educate a lot of people. I got another question, and I don't know if I'm going to find it in our budget or if it's out there, but before we get off our budget, I'm going to ask, Doug, where is the 911 money that is supposed to be in here so we can redistrict it?
There was multiple things needed.
Mr. Henry?
As to the education, I know that, speaking with some of the election commissioners in their council, part of what they contemplate in their budget, which is increased in FY11, is meetings to educate the populace and the citizenship on these new districts. And obviously that, because I've spoke about that being a joint effort with the council. So when they have those meetings, obviously the councilors who are part of these new districts will be at those meetings. So part of that is going to be in the election commission budget.
I believe this budget was compiled either in conjunction, right about the same time, or before you guys passed that legislative act in full council to do that, what you're talking about, Jody, with the 911. I think his budget was already...
So it's not in here?
I don't think it's... No, in Callie's...
Yeah, separate funding was not identified for that. I think the budget had already, was either almost here or delivered before that legislation was passed.
So no answer. There's no contemplation to...
I know I've talked to my county commissioner, because mine's one of them that does not have the enhanced 911. There has been funds identified through Gateway, through the stimulus funds, to bring all of us up to 911, to bring us all up to 911. My problem with my county commissioners is they said, don't even bring us up there, but we don't have no money to run it once you get us there. We have no operating budget, we have nothing at the end of the year. So once we get it, you ain't gonna get no information because we don't have no money to run it. So my question is, because it was attached to a piece of legislation saying we would do this 911, how much is it going to cost to get this up and running so we can redistrict? Where's the money going to come from?
Is there an opportunity to apply for some of those stimulus funds by the nation?
Well, the county, that's what I'm saying. The Grand Gateway is doing it around this area. Diane Kelly's done talked to them. McIntosh is getting them. Adair County's getting them. I'm assuming you all are. But we need operating expenses.
I think Pat wants to address that.
I'm just going to amplify what the treasurer said. I'm aware of the legislation. I don't think we've made a decision as to where any additional monies would be placed that would have to be addressed in a mod. I mean, one of the things that we would need to find out is most counties pass bond issues and got money set aside to do the 911 work, and so we'll have to get with the counties and find out what money is needed and how we can facilitate that. I mean, we're committed to do that. We just don't have the cost for it yet. And it was addressed. It came up after the budget was already being submitted, and it just couldn't put anything in there because we didn't have an accurate estimate of how much that would cost at this point in time.
And different. Some counties already have full funding. Some don't, such as Adair.
Some are further along than others, I think. Muskogee County, I think, Don is pretty much got their 9/11. Wagner County is behind. We know Adair County is behind, and some of the other
So basically, we're back to square one. I think this is very important to all of us here, or the majority of us anyway. Doug, how do we remedy this? I want 911 like we said we would so we can look at this redistricting. Doug, do you know? Or you can get up here with Callie?
Well, I think the issue, Councilor Fishing Hawk, is we don't know how much money we need, so how can we ask for the money yet? It is something that is important to everyone at the Cherokee Nation. It is something that will be a priority, and we will have to bring it forward as a mod once we know an estimated cost that's reasonable. At this point, I don't know if it's $5,000 or if it's $500,000. So it's just something that will have to be brought forward. in October or November, when we have better information on what this is going to cost. It's not a tiny project, is my understanding, because it impacts several counties. You're dealing with different local governments, and it's going to take a while to get a good number on that.
Is the county the best source for that information?
There's an Oklahoma and Hampton, there's a commission that you go to on the web and
But
call.
if we got, like, say for instance, we got 5 counties that don't have enhanced 911, that's affecting this. Would the county be the one to go to say, okay, what's your estimated cost? If we're going to help them get there, could they provide us with those numbers?
Are we talking about putting this in the tribal council budget?
I'm going to be honest, I got the floor, but I'm afraid that us here are going to be the ones that's wanting to get it done faster than that group over there. I'm going to be honest. Otherwise, I think we wouldn't be sitting here today in this predicament. That's why I'm discussing it in tribal council and under our budget. Maybe I'm wrong. Maybe they're going to be in a hurry to do it over there. I doubt it.
Councilor Kevin Watts.
Thank you. The legislation, if I recall correctly, asked administration to administer, as the executive branch is responsible for. But I think it is, given the timing of when the legislation passed, that I understand that they probably couldn't get it in the budget. So at the next rules meeting, where that legislation originated out of, then we would need, maybe not at this month, but next month, there needs to be a discussion started and probably something passed the following month, because you have tight deadlines that have to be complied with. And that is a lot of work, even if it was only 1 or 2 counties, let alone I think there's maybe 4 or 5 of the 14 impacted. And there was multiple things that will have to be budgeted. There's of course the work with the geodata and the GIS for each county, but then there was also the temporary hire of employees that would have to work with registration and IS in order to comply with an actual, like I think we envisioned a phone audit of our tribal citizenship database, where we go through and actually try to track down all of our citizens to see if they were alive, where they lived, and how we could get their information current. So there was multiple things that had to happen, and I appreciate Councilwoman Fishing Hawk bringing this up, because those deadlines are upon us. That will be here before we know it, and that has to be done before that next 2013 election. So, but I think given where we're at in this budget process, it'd be best to do that in rules, and at that point, we'll just have to do a budget mod and figure out where that's going to come from.
I think the administration.
Do you want to come up, Pat?
We would concur with your thought process about doing that. I think it is probably most logical that the administration do that, because the registration department, our geodata, and other program service need to do it in concert. We will also have to work very closely with our county partners who have the primary responsibility to do the 911 locations, because it's basically for emergency management response, to more accurately identify the physical location where residents are. So I think by maybe not this month's rules meeting, but by next month's rules meeting, we'll be prepared to make a proposal and provide you with some logistical information about how it might be done.
I don't know that it needs to be in a form of a motion, but so in September, so October's rules meeting, I would ask that on the agenda, that administration presents a plan for how that legislation will be complied with in both those separate action items that were called for and passed in that legislation. We negotiated it, so I mean, it sounds like you still concur. You weren't in on those negotiations.
That's correct. I was not.
But we've been tasked, and there was originally agreement to do that in that fashion, and it has to be done quickly.
Okay.
Because those deadlines, I mean, it'll be here, I mean, in no time.
We will be prepared to make a recommendation at, say, the October.
So an actual time, at least a high-level timeline, hiring, contracting plan, the groups involved in a budget is
Right.
what I would like to see.
Because it involves
Okay,
a number of our programs.
Duly noted to the Rules Committee
Okay, perfect, thank you.
Okay. Counselor Hoskins.
I withdraw, thank you.
Counselor Buzzer.
And I withdraw, I think they've answered my concerns.
Counselor Jordan.
Might I suggest, since this appears to be a subject that is most important to this body, that, and Kara, this might be something you might want to think about, why don't we let Doug spearhead getting that information, and then have he and Pat work on that together, rather than it coming the other way, because it's most important to this group. It appears to be most important to us that we get it done.
I have no objection to that. Be glad to work with that.
Counselor Cowan Watts.
Thank you, Mr.
And then we
Chair.
need to move off of this.
Since the speaker's assigned to the staff, it's whatever she concurs with. I mean, if that's, but I have no objection, handing responsibility over.
Maybe Doug's got an I know.
Well, we didn't ask Doug.
I'll do whatever y'all want me to do.
Okay.
I don't have a problem working with that either.
Okay, Counselor Soto.
Yeah, I think this brings up a point, Doug, is that, we're talking about a plan that really hadn't came together yet. There's obviously a lot of costs associated with that. So where is some contingency in this budget for those types of items? I mean, I know, is Callie able to comment on that? Are you able to comment on that? I mean, all of a sudden we're already jumping up into a couple $100,000, and we just had $46,000 that was basically unallocated, and we just allocated it. And so I think we're on line 2 of this budget, have covered several others. But where is the contingency at?
Well, I wouldn't recommend going into the contingency reserve, seeing as how that's the only rainy day fund, so to speak, we have. We had another one, but we're having to use it for scholarships. We have a large one, but it's collateralized for the Bonita Clinic. So this is not something that, in my mind, would qualify as a contingent use anyway. We knew about this before we ever entered that year. We just didn't know where we were going to identify the funds.
Okay,
So
but we
this is
did.
going to have to come from either budget cuts or waiting until, it sounds like it may not be able to wait, but either waiting until carryover comes forward because it's a one-shot deal.
Right.
That's the good type of use for carryover.
And this happens when you're doing budgets, right? I mean, this type of thing happens. So just how large is it, and how many times will it happen is the question that maybe I have. So I was just wondering if Callie could maybe comment later on where these types of surprises are going to come from in the budget.
I hope we don't have very many surprises.
Okay. Thank you, sir.
Okay, Counselor Fishing-Hawk.
That's why I wanted to free up some of them gen fund health dollars earlier that we're going back to, because of a couple of things that I knew of that was going to come up in the budget. That's all I have to say.
Is there any further motions, discussion on the tribal council budget? Not, we'll move to tab 1, the chief's budget. The chief's office. Okay, Doug.
Okay. Chief's budget. 5th tab, okay. Chief has a $4.2 million budget. It's down about $1.4 million from last year. You'll notice that there's 3 years of in excess of $1 million of under expending the budget. There are a few consistencies in here. The communications department has consistently underspent approximately $500,000 out of its budget. Government relations in 08 underspent $236. In 09 it underspent $659, and it's projected out in 10 to underspend $440. The chief's office as well.
Is that what you're saying? I couldn't hear.
Pardon? Excuse me.
What are you on? I couldn't hear.
Oh, government relations. I was going over the three main budgets that have historically, for the last 3 years on this chart, is in the underexpended section of the bar chart. The 1.1, the 1.3, and the 1.4. Okay, which would be in communication, government relations, and the chief has got a forecasted under expenditure in 2010, but his budget was pretty close in 2009. The 9 again is our actuals, our last audited. The 10 is a forecast. So the 1.3 million of 09 makeup is 534,000 in communications of that went unspent, and the government relations unspent their under expended their budget by 659. Chief another 160. Funding sources. He says predominantly general fund. A few of the components of the office of the chief, primarily in his budget, is coming out of the indirect cost pool, as well as I believe part of the communications budget. The communication budget is 500,000, is half of that indirect cost pool budget. Staffing, there's no new positions in here for Office of the Chief. There are some vacancies, however. The 386,000, 138 of that is in the communications department, and 161,000 is in government relations. And you'll see that here's the 9; those are related to 9 vacant positions, 3 in communications, 4 in government relations, and 2 in Office of the Chief. I will point out, of those 9 vacant positions, 7 of them are funded out of Gen Fund. Now, in essence, there's 3 continuing departments within this group, the communication being first. Now, it appears on the surface, communication has a 556...
What's the 7 positions you said is funded out of Gen Fund that are vacant? What's the total?
Total is in dollars?
Mm-hmm.
For the...
Yeah. The 386? Right. Yeah. That sounds right.
274,000.
Okay. Thank you.
Okay, communication has a 29% decrease in a budget of 556,000. That's totally due to the removing of the image campaign budget. 309,000 under the 09 actuals.
We have a communications budget within the chief's office that has traditionally been underutilized. And I wonder if this might not be a spot where we could take money for our 911 work that has to be done. Because after all, that is improving communications. Between these two line items, there's like 1.25 million for communications, and you all just passed 46,000 is all we have to communicate with our constituents. So it's a little disproportional, and it would appear to me, since it's underutilized, that this could be a place that we could consider using some of that money to implement and bring up this 911 information that we need, so that these 5 counties that don't have 911 can then get good figures, and we'll know where all of our constituents are, and that's a form of communication. We've got to find out where they're at. And it's underspent traditionally by the 2 of them by $785,000.
Well, I want to point out, page 6 gives you a real clear indication on this of each year's underutilization of their budget and where those funds are coming from, more importantly. Because part of that underutilization is indirect cost pool. Now, would a 911 project qualify under indirect cost pool?
It would qualify under that 10-10-90, though,
You know what I'm saying?
that's underutilized just this year by $389,000. And this is a project, folks, that it's got to be done. We've got to get a handle on where our people live, where they are, what their numbers are. We've got to know this, and that's communication. So I would think a portion of this could be used for that 911 project. And I would put that in the form of a motion. This is a cooperative effort between the chief's office and the council. And so I would hope that the chief would be in complete agreement that some of these underutilized funds within his budget could be used for that project. So I would suggest that we take $250,000 and move it to that for that project from this budget.
Second.
Just that.
Okay. Okay.
That still leaves $140,000 underutilized.
So the motion's been made and seconded to $250,000 from communications, 10-10-90, take $250,000 to the 911 project. And Councilor Calhoun Watt.
Thank you. I am in no way opposed to the overall project being done, but I am concerned that we don't wait and make it a budget mod and focus on what the actual costs are, because I think we're going to potentially create more havoc for ourselves doing it this way. I can't support doing it at this time in this manner, but I'm happy to work or whatever we've got to do to find the money when we have actuals and a plan presented to us later at Rules and E&F. So it's not that I'm not supportive, but I just think we need to do it differently. Thank you, Mr. Chair.
Okay, Councilor Thorne.
The only thing that bothers me here is the in communications on the FTEs. How many FTEs does that fund have?
We got two vacant positions.
Maybe I'm looking at it wrong. I'm looking at 12 altogether, but 12.5.
It's 12.5.
It's,
12 and a half positions in communications.
12.5 positions.
and if I could clarify,
Funding is,
they're split half from gen fund and half from the indirect cost pool.
it doesn't make any difference on FTEs for the chief position. If you read the Constitution says that the chief can have as many employees under his budget or whatever as he deems fit. It doesn't make any difference what you do here. You can't get rid of those FTEs or that funding for those FTEs. So I'd read that Constitution real close before I start to cut any of these positions. Thank you, sir.
Might I just respond to that real quick?
Yes.
Compared to
I think
1.4 million.
we can see a pattern here that traditionally communications is underspent by at least that 250,000. In 08 it was underspent by 334. In 09 it was underspent by 284. It's projected that in 010 it's going to be underspent by 389. That should not affect any positions that the chief wants within his area. This is just totally underutilized money that is going back each year, I guess, to be reallocated for the same thing and being underutilized the next year. And this project is critical. I mean, we've got time constraints within that act that we passed. We said we would do these things within a certain time limit. And with all due respect, and I agree with Kara, we cannot wait until we have the firm numbers. We can make adjustments, but we need to have some money in this project right now. If we're really going to go forward with this and accomplish what we told the people we would do with that act, we got to have some money to make it happen. And it's communication money. It's just using communication dollars to find out where our people are at. That's certainly a good use of communication dollars. Thank you.
Councilor Austin.
Yeah, I just echo what Councilor Jordan said. We have a commitment that they're going to come to us with a plan, but that shouldn't stop us from putting some money on the table to fund that. particularly as quickly as we need to act, and certainly if they come back and say, we don't need that much, we make adjustments to the budget every month. It's been demonstrated that this money communication does not get spent. So where's the compelling reason that we don't spend it for what's probably the most important cause to our institution? I don't think there is one. I think we should support this thing, Mr. Chairman.
Kelly?
Just a couple of things I would like to point out. The Gen Fund budget for communications has already been reduced by $90,000 from the 09 level. The 2010 projection column is a projection that Doug did based on the information he had. Some of the projects are heavily loaded towards the end of the year, such as all of the communication items that go out for the holiday. I don't think anyone in administration disagrees that this is a priority, but we're proposing to take funding from a budget for a project that we don't even know how much it's going to cost, and that, you know, it's absolutely true. This is communications, even though it falls under the office of the chief. It's communications for all of Cherokee Nation. Perhaps after we know what that number is, you know, there may be some room within this budget to utilize for the 911 project. We removed from the 2011 budget request all of the funding for the image campaign to save money. Communications had several vacant positions. As of August, all but 1.5 of those have been filled. So we're looking at a trend, yes, of underspending in some of these, but that changes throughout the months, and by just saying, well, we think they can live without $250,000, I don't know that to be a fact. I don't know why we couldn't utilize some of this money if in fact it is extra for this project, because it is communications for the entire nation. Thank you.
Yeah, I just wanted to kind of follow up on to clarify a statement that that Councilman Thornton had made. The Constitution does not give the principal chief carte blanche to have as many employees as he sees fit. I think what we're talking about would be Article 7, Section 12 of the Constitution, that says that he may prescribe cabinet members, and that cabinet positions can only be abolished with consent of the consent of both the chief and the council. But for instance, I mean, the principal chief, if he said, I got to have 200 employees, that the Constitution does not give him the authority to just carte blanche have 200 employees.
Councilor Bishop.
Okay, I'm looking at this, and he's got $737,000 in communication for 2011. You said $250,250,000? That leaves him with $587,000, and that is still $45,000 more than this communications budget has ever spent in its highest year. Not to mention everybody's thinking about cutting back, which is why I figure the 2010 project projection is only $365, and I realize there's end of the year things coming in, but over 3 years' time, there wasn't too many end of things coming in that took a whole budget. So I don't see a problem with it. Like I said, we're still leaving them with more than they ever spent. And folks, it was so important when they prepared this budget. It was going on at the same time we was doing the 911 discussions, that they left it out. That's how important it was. That's all I have to say.
Councilor Calvin Watts.
Fine, thank you.
Councilor Gardner.
Doug, on the donations to the Wish and Moreau Women Children's Home, where is that?
It's in the.
So we have another motion on the floor. We have a motion on the floor to move $250,000 from communications. Is there any further discussion on the motion? Then all those in favor of moving the $250,000 signify by saying aye.
Aye.
Those opposed?
Aye.
And we need Shelley for a roll call.
Mr. Chairman, there's some comments about my numbers. I'd like to defend my report. Those underspended dollars from 2008 and 2009 are audited, and the 2010 forecast is based on 10 out of 12 months of actual expenditures. I only had a forecast 1/6 of this current year.
And
Okay.
I don't disagree with that. It's
We're taking a vote right now. Okay. Those in favor of moving signify by saying aye. And those opposed, nay. Okay, Shelley.
Meredith Fraley,
No.
Janelle Fulbright, Don Garvin,
No.
Chuck Hoskin Jr.,
Yes.
China Glory Jordan,
Yes.
Chris Soap,
No.
Curtis Snell,
Yes.
David Thornton, Kara Cowan Watts,
No.
Bill Anglin,
No.
Bill John Baker,
Yes.
Jack Baker,
No.
Harley Buzzard,
No.
Julia Coates,
No.
Bradley Cobb,
No.
Joe Crittenden,
Yes.
Jody Fishinghop,
Yes.
we have 6 yes and 9 no.
Okay, motion fails. Okay.
Government Relations Department, is getting ready to...
Councilor Garvin.
It's in here.
He's going to get to it.
Okay.
Is decreasing 25% compared to the current year budget. The operating budget for government relations is increasing by $622,000 or 175%, partially due to the removal of the legislative office budget of $468. So you had to net those two together. That one budget's going up $622. The legislative office of Washington D.C. budget's going down entirely by $468,000. Other decreases are charitable contributions by $429,000, Get Out the Vote $375,000, and communities at large $105,000. That's in comparison to this current year budget.
Councilor Hoskin.
Thank you, Mr. Chair. What accounts for the legislative office being zeroed out? How does that reconcile?
I assume it's added to the regular operating budget that appears.
The legislative office was just folded in with the regular government relations budget, so that, just administratively, you've only got one accounting unit to manage instead of two.
Where the government relation functions, where were they? Were they here in Tahlequah?
Well,
the legislative office was separate?
The legislative office was a separate accounting unit. When the Washington office was opened back in, I don't know what year it was opened, it was set up as a separate accounting unit, and then it was all reorganized into one accounting unit. Government relations here in Tahlequah is, Ginger Brown and Paula Hamby is involved with that. All of it falls under Melissa Gower as the group leader for government relations, and so it was just all rolled together into one operating budget.
How will we discern how much we're spending on that Washington office? Based on this, we can't really figure it out.
Well, we would be able to do some analysis, and we could see, for example, the rent and the staff that actually operates out of that facility.
We wouldn't be able to get a report off the system.
No.
They'd have to give us something to break out those expenses.
We could utilize our activities module in Lawson to charge those separately.
The purpose for combining.
Okay, Councilor Fishinghop.
Did you have something else, Chuck?
No, I was
Okay. Let me get if I understand this right, Doug. Operating expense are going out at the cost of charitable donations, because how I'm seeing this, charitable donations is taking a hit of $430,000, charitable contributions, and we're putting $160,000 in admin's budget? Am I seeing this wrong? Please tell me I am.
Well,
That's
no.
kind of selfish.
Admin in the current budget for the two budgets combined for $830,000. This budget, 978. So the legislative office and government relations in the current budget is 160,000 more in 2011 than it was in 2010.
That's what I said. The 430, like charitable contributions, is taking a hit of 430, but we're putting 160,000 back in admins? Because that's what I'm seeing. It's saying we're getting reductions, but operating expenses is going up at the cost of, for lack of charitable donations, for one.
Any new positions in here?
Nobody's hopping up, so I don't guess I'm missing nothing.
Councilor Cobb.
That is my question, thank you.
Continue that.
Principal Chief.
I just would like to go on the record, and I'd like Shelley to write this verbatim, that I am totally against taking 430 from charities and giving it to 160 of it to admin for operating expenses. And I'd like that down as being ridiculous and selfish.
Then we need to get Shelley in here to record it.
We're recording.
Okay. Yes, Pat.
In fairness, this is the Secretary of State's got the lead for this particular budget. I was not involved in the formulation of it, so I don't know a lot of the details. But I think that if this is an outstanding question, that you wait till Melanie is back. She had to take care of her mom today and had to be out on personal leave, and so is not here to defend the budget. But what I would suggest is, if you want to revisit this, we can come back and Melanie's going to be here to address it, because I don't know the answer to all the specifics of your question.
Move to table till tomorrow at 11.
Second.
Thank you. Thank you.
Okay, the motion made and seconded that we table the chief's office until tomorrow at 11. All those in favor signify by saying aye.
Aye.
Any opposed? Okay.
I'm opposed.
Okay.
Gotta be
One
somebody.
opposed.
Thank you.
So the chief's office is tabled until tomorrow. Okay. Next is the judicial branch. Where's our lunch? Here yet? Okay. The next is the judicial branch.
Okay. The effect here on the judicial branch is a slight decrease due to the removal of that expansion planning budget of $100,000. See, it's all general fund, of course, for the courts, and they have no new positions or vacant positions. Their budget, their dollars are going down by $65,000 budget to budget because of that planning one. The $150,000 increase over 09 actuals, as you recall, there was a slight stipend increase. It happened, I believe, early in FY10 or late in fiscal year 09 for both district and Supreme Court. And that, there's not a whole lot to report on that, but not significant movements other than those stipends.
Mr. Chairman, I make a motion we approve it as presented.
Okay, I don't know that that's a necessary motion.
Gets us up, but on something else.
Second.
I'm ready to keep going.
All in favor of
Rolling.
approving the judicial branch as presented, signify by saying aye.
Aye.
Any opposed? Okay. Next is the Attorney General.
Boards and commissions, I believe, Mr. Chairman.
Pardon?
Boards and commissions,
Oh, did I miss one?
which is really just primarily the Arkansas Riverbed. All this is the Arkansas Riverbed and Employee Appeals Board. See, obviously, there's a lot of earmarked DOI funds that have remained unexpended from year to year. These are earmarked, is that the right word? Restricted or whatever. Earmarked funds, so they just stay there. It's all in contract services where this unexpended dollar is.
Mr. Chairman, I make a motion to approve.
Second. Okay, any discussion on boards and commissions? And all those in favor, signify by saying aye.
Aye.
Any opposed? Okay. Okay.
Okay, Attorney General has a $2.6 million budget compared to a $2.8 million budget the previous year. The unexpended balances in here primarily is in the Attorney General, their operating budget, which constitutes about 2/3 of these balances in 2009 and 2010. The Advocacy Initiative is also contributing some of these unexpended dollars. By funding source, you can see there's about a $250,000 decrease on the general fund compared to 09 actuals. And on their staffing for the Attorney General, there's no new positions. There are some vacant positions, 3 for $157,000. That's considerably down. As you can see, some of them got filled last year from 14 up to 16 on existing, and but they've reduced 4 more that was in their staffing plan from the previous year. That budget is $245,000 less, and it's in the Advocacy Initiative budget itself. There's a slight decrease on their IDC funding the Justice Department has. It's a $109,000 decrease, but it's kind of a net effect compared to 09 budget. There's a $575,000 decrease in the Advocacy Initiative budget compared to 09 actuals. It's going down by $575,000, but the Attorney General's operating budget is in excess of their 09 spending level by $455,000 or 36%, primarily in those staffing-related expenses I mentioned earlier. So they are experiencing a significant increase over 09 on operating expenses, personnel-related. That's all I have on Attorney General.
Any discussion on the Attorney General? Councilor Jordan.
I noticed that they have a vacancy in their office for Senior Assistant Attorney General and for a paralegal, which totals $200,000. And previously, Councilor Thornton and myself had asked them to give us the number of attorneys, the number of people that they had in their office, and they are basically approaching a major law firm number within our organization. And I'm suggesting to you that we probably don't need to fill those 2 positions, which would free up $189,000. I would like for Ms. Hammonds, if she could, to be here when we have this discussion, because I don't want to blindside her. But we've got a $2.5 million budget for the Attorney General's office for basically attorneys and paralegals and such. And that, I can remember a time when this tribe for the whole year with contractual services and everything didn't even approach even $500,000. In fact, I can remember a time where that was an election issue, that attorney fees were spent in excess of what they should be spent, and the figure we were talking about was $600,000 for 4 years. It just seems like we need to get a handle on the fees that we're spending on attorneys. Contract attorneys alone, when I asked for the billing, I found out we were paying $700 an hour for attorneys. And folks, I'm an attorney. Chuck's an attorney. Meredith's an attorney. And I can tell you, we don't command anywhere near that hourly fee, and I don't think they should have commanded that hourly fee. So I really think that we need to get a handle on these fees. And by comparison, let's think about this. What we pay our one little lone attorney compared to what they have for their budget. And I just think that we need to possibly think about not filling these two positions and freeing up that money, which is 1010 money, again, which is tribal money, to be used for direct services for the people. And I put that in the form of a motion. Don't know if it's going to do any good, folks. But before you ask to put money in something else, you got to find the money to take from somewhere. And I believe that we could squeeze that much money out of this budget and still leave her the ability to do her job in a very effective way. She has a great amount of experience. She just hired Susan Work, who has a tremendous amount of experience. And so I don't think we need to hire us another senior assistant attorney general at $116,000.
So you made the motion?
And I've made that motion.
Clarify what that motion was. Could you restate it?
That we reduce her budget by $189,407.
By eliminating the two vacant positions?
Eliminating the two vacant positions. And again, I apologize if I'm somewhat blindsiding her, but I really think that this budget can stand that, and I really think we'll see no reduction in the legal services provided to this organization. She has some very effective people on board. I don't think we need another senior assistant attorney general at that price of $116,000.
Okay, is there a second to the motion?
Second.
The motion made and seconded. Discussion on this issue. Okay. Councilor Hoskins.
Just briefly, is there anyone from the Attorney General's office here? Ernie is here, but that's why I was trying to get the floor. Diane had an appointment. She can be here around 1:20, I believe, and I do think it would be appropriate to have this discussion when Diane is here. Yes, this group is staffing up, and part of the reason for that is to do more of the work in-house rather than using outside attorneys. We've reduced the advocacy initiative significantly, and that's where a lot of the high-dollar attorneys were being paid. So if with the council's indulgence, I would like to defer this to when Diane can be here.
This is very important to me, this subject area. I would ask that we set it for 10:30 tomorrow morning, because I have to go to my brother-in-law's funeral here in just a little bit.
So you're asking to table?
And this is very important to me that we discuss this, and I do want Ms.
So you make a
Hammond
motion to table it
till
till
10:30.
Is there a second?
Second.
Okay, all those in favor of tabling signify by saying aye. Aye. Any opposed? Okay. So the Attorney General's table till 10:30 tomorrow.
Okay. Mr. Chairman?
Yes.
We've already gone over, right, education and health?
Yes.
So the next would be financial resources?
Yes. Yes.
Finally.
Financial resources tab over.
We worked right through it. Oh, yeah, I'll just keep going. How's that? Okay, financial resources, again, it's a kind of a catch-all for a lot of the financial transactions and the carryovers and transfers. The big reduction here from 09 to 10 is related to a transfer to the general fixed asset account group of $6 million. Better describe it by funding source, since there's a lot of stuff going on here. You can see that the general fund is increasing significantly, and that's the contingency reserve that's in the budget figures that's not in the actuals. Okay, since we don't actually cut a check called contingency reserve, it's always in the budget as a reserve. So that's why the budget is so much higher than 09 actuals. IDC pool, not much movement at all. The other, we have a one-time debt service buyback of the bonds, as you recall, in 09. And the effect of the debt service for the new Bonita Clinic in 2011. So you have those two financing transactions that spiked up the red and the green bars over there. Staffing related to Callie's group, you see there's no new positions in here. A little over $500,000 for vacancies, showing 13 positions in this budget. Several 4 departments here. First off being the indirect cost pool recovery.
Councilor Trump.
I've got a question on financial management, and I don't know if Pat's still here or not. Can this Office of Historical Records, here's where I'm going with this. We've got a bunch of stuff sitting over there in the vault that needs to be digitized because it's like the only copy of it in the world. So I noticed we've got this 171, whatever it is, it just keeps coming through. I mean, my ultimate point is it needs to be done. So what exactly is the Office of Historical Records?
I can address that. That's a new group under me. In 2010, they're funded through support services. It's Flossie and one staff person, and what she is doing is putting together the plan of what we need to do to, obviously it's going to be an expensive proposition to establish Cherokee Nation Archives, to get a building that complies with what we need to have to really protect our historical documents. So she's doing that planning. I think what you're referring to is what is housed in real estate services.
I'm actually talking where Leela is too.
And where Leela is. Real Estate Services has a project that they have been working on for a couple of years, and the ongoing support funding for that is being requested out of DOI for 2011. And they are specifically digitizing all of those old BIA records and trying to get those converted to electronic format.
So when you're looking at Office of Historical Records, you're looking at a building, are you looking at not only the real estate records, but also what I'm talking about, sitting over there in registration vault? Are you looking at getting everything into one place?
That ultimately is the goal. It may take us 5 or 10 years because, like I said, it's going to be an expensive proposition. But that's what we want to be able to do, is at some point in the next couple of years present a comprehensive plan of here's where we need to be with our historical records and our archives.
Thank you. Okay. Continue, Doug.
Okay. All I want to say on the indirect cost pool recovery is comment that we're basically budgeting spend almost all of the projected funding that the programs are going to pay in. So only want to bring that up, that Callie's done a good job in the past of managing those indirect cost pool expenditures, and if the base is not providing the funding, then obviously this is subject to availability of funds. If they end up in a shortfall situation of funding, then that is what will drive a rate increase up in the future. So they've done a good job there, but just always need to keep in mind that we have to control the overhead. We just talked about financial management. The big increase there is all on the indirect cost pool budgets in financial management. Reflects the impact of increased staffing budgeted in FY10. There was an increase this year of staffing along with this Office of Historical Records going into next year. The financial operations doesn't have any movement on its budget other than a reduction compared to 09 actual spending, and again it's due to the non-recurring debt buyback we did on the healthcare bonds that occurred in 09. Treasurer's Office, 33% decrease compared to this year budget, and a 12% decrease compared to 09. Both are related to reduction in staffing in this budget. That completes the Treasurer.
On item 10, it's a 10-10-315 under financial operations. It's a cash match for grants. Callie, you may be on that too.
Yes.
I'm just curious, are you anticipating, that's a 297% increase. Are you 10-10-315 cash match for grants? Are you anticipating a bunch of grants? Or?
We generally have some large grants throughout the year that require cash match.
I'm just curious on why that's a pretty big increase, so maybe some different grants.
It really has to do more with my report presentation.
Yeah.
This report excludes transfers.
Yeah.
Once
We've
she
actually
identifies
used a
a
lot more
use,
than that.
she transfers it out. She doesn't expend it. She transfers it to whoever needs the matching dollars. So, in an effort to mitigate too much confusion that these transfers cause, these reports won't reflect any transfers. She has used what this actually is saying is she's used all but 113 this year.
It's a little over $1 million this year.
Got it.
What we generally in the past have tried to do is request about $500,000 as a reserve, and We reduced that slightly this year because of the funding. Then as grants are identified, we do a reallocation between the reserve and the transfer out to the grant that needs the match.
Okay. So that 297 is actually a little misleading.
Right.
I got you. Okay, thank you.
Okay. Any further discussion on financial resources? If not, the chair will, there's no objection, our lunch is here, and we'll recess for 30 minutes for lunch.